Hey guys, I'm back with another one. Today I want to talk about my experience, the latest experience I had being admitted to the hospital. And just to warn people that please edify yourself before you go into these institutions. Please edify yourself before you go into these sick care institutions. Um, these places are meant to tie a tail on you, right? When you go in, you come out sicker, believe it or not. I'm gonna give you my experience. Um, so I went in, and the first night the nurse came, I went in with a blood clot. I told them exactly where it was, where to look for it, so they found it in like a matter of 20 minutes, because that's how I roll. When I walk in, this is what it is, this is what my body's saying, this is what you look for. Okay, been smooth sailing with this diagnosis that I have of hyperphospholipid syndrome, where my body just clots for no reason. What they were trying to do to me is to, 7 years ago when I was diagnosed, they were trying to give me medication to calm my immune system. They said that my immune system was too vibrant and it was too active. Anything that came that is not supposed to be, my immune system would attack it. Which, da da da, that's what the immune system is supposed to do. Apparently, they don't appreciate that, but I know that's what the immune system is supposed to do. So I told them no. I am not going to use any medication to quiet my immune system, because what's going to happen is going to create, lower the barrier and create an environment where opportunistic bacteria, opportunistic viruses, anything opportunistic could just come in and do anything to my body because my immune system is intentionally lowered. No. So I told them no. Whenever I have an issue, I'll deal with it as such an issue. Okay. So 7 years later, I had another episode of a blood clot. I do not take the new generation of blood thinners because I don't like them. I take nothing that has less than 10 years research. The good old granddaddy warfarin slash Coumadin is the one with the over 40 years worth of research on the book. So that's the one I want. So when I got in the first day to the hospital, they started me on heparin because they have to get the blood going right away, and to attack the clot. So they put me on heparin drip IV. I kid you not. Within the space of 3 hours, my blood levels started thinning out so much that they had to stop the heparin and do blood. So I started smiling. I said, yeah, because the amount that they're giving me is too much. They're over medicating me. It takes 3 hours for my blood to just thin out. So the nurse comes in and she says, oh, we're gonna send a PTI in our stat, or whatever levels they're using to check the thickness and the consistency and the clotting ability of my blood. She comes back. She says the doctor says to hold it and do the blood test. Okay. So she holds it. She does the blood test. she's putting it back on. And I was like, why would you put it back on? Are they going to adjust the levels that they're giving me? Oh no, the doctor says just to put it back on until the blood levels come back. Okay. So the blood levels come back. Yes, my blood had thinned out like that. So now she's adjusting the blood levels. Okay. So I'm watching them. That was the first day I got to the floor. So the night she came with, I told him to stop the heparin. I said, you know what? Stop the heparin. I'm gonna make that call now, because you're not gonna kill me in here. Stop the heparin. Doctor comes in. We had a conversation. I want to be on Coumadin / warfarin. Doctor says yes. Agree. I had enough heparin in my system. The blood was thin enough where it could take me into the next day, really, because that's how quickly that thing thinned my blood. So that evening before bedtime, the nurse comes with 2 medication. She comes with Eliquest, which is one of the new generations of blood thinners, and she comes with Pepsid. So I said, first of all, both of these medications are wrong. I don't want Eliquest. That's one of the new generation of blood thinners. I don't want that. Me and the doctor discussed it, and we agreed that we were gonna do Coumadin / warfarin. Okay? Number one. Drug number 1. Drug number 2. Why are you giving me Pepsid? Oh, the Pepsid is to coat the stomach, for the medication. It's just to coat the stomach. And I was like, I was not complaining about anything in my stomach. Anyway, let me take the Pepsid. All right, whatever. I don't know what y'all coating, because I haven't taken any medication yet, and I'm not on any medication. So what are we coating? Anyhow, I took it. I was really not taking the Eliquest. So I said to her, call a team. Now, this is Friday evening. This is the weekend before Memorial Monday. So there's nobody in the hospital. So a PA comes in. He says he's covering my team, and I should just go ahead and take the Eliquest, and then the next day they will sort out and switch to warfarin. I said, no, thank you, sir. No, I just want to let you know that you're putting yourself at risk. Da 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 da. And I'm like, I don't want Eliquest. Call somebody and have them send a prescription of warfarin for tonight. They're not going to be able to do that. I'm going to have to take what is ordered, and then they'll change it in the morning. I said, no, sir. No, sir. No, sir. No, sir. Not doing it. You know how I love to say no. No is my favorite word. So anyway, I said no, and I only took the Pepsid, which I shouldn't even have taken, because that was bullshit. I didn't need Pepsid for nothing, but they had me on bed. They ordered Pepsid for me. All right. The next morning, they did follow through. They did order the warfarin. They kept me. So I said to them, I said, well, the last time I did blood thinner was last night, heparin drip. So the warfarin won't be until bedtime tonight. So what's gonna cover me all day today? Oh, let me ask the doctor. Okay, doctor says, all right, they're gonna give me a shot of Lovenox. Nobody came back. I wasn't worried. I didn't say nothing. So anyway, they came tonight with Lovenox and the warfarin, because the Lovenox is to keep the blood thin enough until the warfarin kicks in, because The warfarin takes a couple of days to kick in. Okay, fine. I went home. I'm not afraid. There is no fear in me. No fear. Okay? So that's what's killing people is fear. I have none. I'm afraid of nada. Okay. Next day, that night they finally got it. I was given the Lovenox shot in my stomach, and then they started me on warfarin slash Coumadin. Fine. So now, in order to get the warfarin levels up in my system, to get my PT-INR between 2 and 3, it has to take a couple of days. So that's when I go to the hospital, I ain't on shit, no IV, no nothing, but they just have to get those levels up, and it does take a couple of days. Next day, the nurse comes in, she has the Pepsid, she has my warfarin, and she has Lipitor. I said, why am I on Lipitor? Oh, the doctor ordered. I said, why would the doctor order Lipitor? Isn't Lipitor for cholesterol? Yes. I don't have a cholesterol problem. Could you please check my blood levels? She goes in her little computer and she checks. She's like, yeah, your cholesterol is 70. Okay? The range is supposed to be anything below 200. 200 and lower is the accepted range. Mine's is 70, and they're ordering Lipitor for me. So I said, no Lipitor. I don't want it. So now, and I'm like, that Pepsid stuff too, I don't want it either. So I refuse the Pepsid and I refuse the Lipitor. The only thing I'm taking is the Lovenox, and I'm being bridged onto Coumadin slash warfarin. Let me tell you, be very careful when you go in these places. They have a bunch of people running around. Yeah, they're sweet, they're nice. Oh, Mrs. Francis. Oh, they're very helpful, they're very sweet, but half of them don't know what they're doing. If you just look at how they take a blood pressure, you see that they don't know what they're doing. Now, when you're taking a blood pressure and you put the blood pressure cuff on, the blood pressure cuff, that's the cord or the wires, is supposed to be pointing at the corner of your wrist right here in the crease, because it's trying to pick up the pulse. That's what's measuring the pulse. If they have that wire in the back of the elbow, sometimes they put it here, you're not getting a correct blood pressure reading. As a matter of fact, if you have a blood pressure problem, you're in deep doo-doo, because it is showing that your blood pressure is lower than it really is, because it's not being measured correctly. It's the cording that goes to that machine is supposed to be pointing right to this pulse right here. So I laugh. I don't complain, because I don't have a blood pressure problem. So I know the ones that come in and get my blood pressure correctly, and those that just kind of wing it and write something down. Another thing, when they come in to do blood, the girl from the lab, she was on point. Boom, boom, boom. She gets your, no. Go for them little ones right here. Don't go here, because a lot of people don't know what they're doing. With mine's a deep, so you have to palpate and aim right. You can't see them from here. You can see them here. So go here, sir, ma'am, because these are giving too. So I don't do blood here. I only do IVs. Fine. When they come to do the blood, so she found a vein. The vein is running kind of slow. Instead of her holding the tube down so, or pulling my hand down and hold the tube down so you get the whole gravity concept to help you get the blood. The girl holds up the tube in her hand like this. And I said to her, if you're having an issue with the vein being given, why are you going to hold the tube up? You have to hold it down. So gravity helps you to get the blood. These are the little things that you have to be aware of. Let me tell you, day number 4, they ordered, this was the cardiologist that came in, and we talked, and she wants to send me for some kind of, they're gonna check the heart to make sure, we're not suspecting anything, but we just want to check to make sure the heart is okay. Okay, I love doing tests. I'll do tests from now until next year. You give me any test, I just don't want their medication. So I said, okay, even though the heart test, I was gonna be going under this big old machine. They were gonna be they injected like this fluorescent shit in my vein. I'm gonna have to double up on the castor oil to get that shit out of my system. They put the medication in the IV, and what it does, it does color, around the heart and stuff, so they can take a good look at the heart. So of course they looked at the heart, and doctor says, this is the heart of a 16-year-old. Thank you. That's a compliment. Day number 4, Dr. Chen comes in, the cardiologist. The woman orders, because everybody got to come and order something. Everybody got to get a piece of the pie. She orders B12. So the nurse comes in, and it's the B12 shot. Goes right into the blood. So I said to the nurse, why are we ordering B12? Is my B12 low? No, your B12 is not low. But Dr. Chen is here. I'll have her come back in and speak to you. Okay. So she comes back in. Oh, I ordered you B12 because I just want to give you a burst of energy. Your B12 level is normal, but I just wanted to give you a little boost of energy. I said, there's no toxicity to B12. It's okay. I said, no, thank you. I don't want it. My B12 levels are normal. That means my body is getting the B12 from the food that I'm eating. I don't want a boost. I didn't tell you that I was tired. I never complained that I was tired. Why am I getting a boost of B12? So you have to understand how they subtly and sweetly push things on you. Oh, but there's no toxicity. No, I don't want it. I don't want it. So by day number 5, my INR levels were where I needed them to be, and I skedoodled out of there. Educate yourself, people, before going into any of these doctor's office, before going into any of these institutions. These places are a trap. Do not believe in this United States sick care model. It's a sick care model. They make you sick so they can take care of the sickness. And then they over-medicate you until your glomerular filtration rate, which is the rate of how the kidney filters the shit of a medication that they're giving you, starts going to hell. And then you're on dialysis. Be careful. That's all I gotta say. Watch your backs. These people are drug pushers. I was on Pepsid for no reason, on Lipitor for no reason, getting a boost of B12 for no reason. Because guess what? It's not normal for a 50-year-old to walk into the hospital on no goddamn medication. I should be taking something. No, sir. Not an elevated blood pressure. My A1C is, yeah, no cholesterol, a cholesterol of 70 when it's supposed to be below 200. What are you medicating me for? Do not be afraid to ask questions. Do not be afraid to look shit up. AI will help you. You get on Google, you Google shit. You get on Chat GPT and you look shit up. Ask, look it up, because these people are not. When I worked in the hospital, the nurses questioned the doctor. Because especially summer's coming up, you never get sick and go in the hospital in the summertime in a teaching hospital. It's all little quack of a doctors running around in there straight off the classroom floor. Don't have a clue what they're saying. But guess what? The more experienced nurses they are the keepers of medication. They'll notify the doctor, this, this dosage is incorrect. Why are we ordering this? There's nobody questioning them anymore. You know what these nurses are just walking in saying? The doctor ordered. The doctor ordered. Nobody's looking shit up. So in the meantime, in between time, you as the patient, you better be on top of your game. Yeah, this is me in the hospital, just cocky motherfucker, just like this, telling them what's gonna happen, what we gonna do. And they're nice as hell, but I know when they get to the nursing station, they're saying, that Mrs. Francis is a pain in the ass. Good. I'm happy. Go in as someone that knows their stuff, because these people are not in there for your benefit. They're in there to make sure they have a nice bill to send to the insurance company. I swear to God, I kid you not. On that note, I'm just here to put this little bug in the back of your ear. You can take it how you want to. With that, until next time, bye-bye.